They say heart attacks come with chest pain and clutching your left arm. But what if I told you that's not always true? Especially after 60, the warning signs of a heart attack often look nothing like what you've seen on TV. No crushing pain, no big drama, just quiet, sneaky symptoms that most people brush off until it's too late. Today, I'll walk you through 7 silent signs of a heart attack after 60 that you absolutely must not ignore, because knowing them might just save your life or someone you love. Silent symptom. Number 1, unexplained fatigue. You wake up and just getting out of bed feels like a chore. You walk to the mailbox and feel drained. You haven't changed your routine, but suddenly everything feels harder. Here's the truth. Unusual, persistent fatigue is one of the most common silent signs of a heart attack in older adults. Now, let me be clear. We all slow down a bit with age. That's normal. But this type of fatigue is different. It's not the kind you fix with a nap. It's not because you stayed up late or skipped your morning coffee. It's a deep, lingering tiredness that can't be explained by your usual activities. So why does this happen during a heart attack? When your heart isn't getting enough oxygen due to a blockage or reduced blood flow, it has to work harder to pump blood through your body. This extra effort wears you out quickly, even if you're doing something simple like brushing your teeth or standing at the kitchen sink. And here's the kicker. You might not feel any pain at all, just this constant, dragging exhaustion that seems to come out of nowhere. How can you tell it's not just normal aging? Ask yourself, did this fatigue come on suddenly? Has it been getting worse over the past few days? Does it feel out of proportion to what I've been doing? Is it affecting my ability to do things I could do last week? If you answered yes to any of those questions, don't wait. Talk to your doctor. As someone who has seen this firsthand countless times, let me tell you, seniors often dismiss fatigue as just getting old, but sometimes it's your body's most important warning signal. Don't ignore it. If feeling drained all the time could be your heart crying out. What about changes in your breathing? Could that also be a hidden sign? Let's talk about that next. Silent symptom number 2, shortness of breath. Shortness of breath may seem ordinary after 60. A lot of folks assume it's just part of getting older. Maybe you've noticed it when walking upstairs, bending over, or even while talking. But here's the truth. Sudden or unexplained shortness of breath can be a silent red flag that your heart is under stress. When your heart struggles to pump blood efficiently, your body isn't getting the oxygen it needs. In response, your breathing speeds up. This can happen even when you're resting or performing light activities. It's not about being out of shape. It's not because of aging lungs. If you're finding it harder to catch your breath and nothing else has changed, it may be cardiovascular. Some seniors feel breathless lying flat in bed. Others notice it during simple tasks like getting dressed. The key detail is how new and unusual it feels. This shortness of breath is often silent, meaning it may not come with chest pain. It quietly builds, sometimes over days or weeks, and that makes it dangerous. From my experience as a doctor, I want to say clearly, if you feel like your breath is shallow or you need to pause often just to breathe, take that seriously. Many people ignore this until it's too late, but you don't have to. Here's a simple way to assess. Has breathing become harder even when doing everyday things? Are you pausing more often to rest, even when you didn't used to? Do you feel a tight or heavy chest along with the shortness of breath? If the answer is yes to any of these, it's time to speak to your doctor. Your breath is your body's way of speaking up. Please listen. Let me ask you this. Have you ever felt dizzy, faint, or slightly nauseous for no clear reason? Let's talk about what that could mean. Silent symptom number 3, nausea or lightheadedness. Now this one often gets dismissed. Feeling nauseous or a bit woozy, many seniors chalk it up to medications, poor sleep, or simply not feeling great today. But the truth is, nausea, dizziness, or sudden lightheadedness without a clear cause can signal a heart that's struggling to circulate blood. When the heart's pumping power weakens, less blood and less oxygen reaches the brain and digestive system. This can make you feel faint, disoriented, or queasy. Not everyone experiences this the same way. You might feel like the room is spinning. You might feel shaky or sweaty. You might need to sit down or lie back because you feel you're about to pass out. And yes, sometimes you might even feel like you're going to vomit. The important thing to understand is that these symptoms don't need to come with pain. That's why they're so dangerous. A person might think they're just having a mild stomach bug or a drop in blood sugar, when in fact their heart is in trouble. My personal view here is this. You know your body better than anyone. If something feels off, especially if it's sudden and unfamiliar, don't ignore it. Even a mild wave of nausea or brief faintness, if unusual, is worth taking seriously. Aging brings changes, yes, but it doesn't mean you should feel off balance or unwell without explanation. Ask yourself, did this dizziness come on suddenly without warning? Was there no change in food, water, or activity level to explain it? Have I had more than one episode like this recently? If the answer is yes to any of those, I strongly recommend having your heart checked. It's not about fear, it's about prevention. Now let me ask you something else. Have you ever broken out in a cold sweat, even though the room wasn't warm and you weren't exerting yourself? If so, that might not be random. In the next part, we'll uncover why sudden cold sweats might be your heart waving a white flag. Silently. Silent symptom. Number 4, cold sweats. Imagine sitting comfortably at home, not moving, not exerting yourself, and suddenly your skin feels damp and clammy. You notice beads of sweat on your forehead, neck, or back, even though the room is cool. This isn't normal perspiration from heat or physical activity. Cold sweats can be your body's silent distress signal, and in many cases, it's your heart that's under pressure. Unlike typical sweating caused by exertion, cold sweats happen when the body goes into a state of shock. Your nervous system senses something's wrong internally, such as reduced blood flow or oxygen, and it triggers a reaction. Your body becomes anxious, tense, and starts to sweat in an attempt to cool down or stabilize. But underneath that response may be a blocked artery, reduced oxygen, or the early stages of a heart attack. For many seniors, cold sweats can occur while resting, sitting, or even sleeping. They may come with no fever, no stomach bug, no physical reason at all. Here's something I want you to remember. If you're sweating but not hot, and there's no clear cause, especially if you also feel weak, nauseous, or anxious, take it seriously. This is your body warning you, quietly but urgently. From my professional perspective, cold sweats are one of the most misleading symptoms. Why? Because people often associate them with anxiety or indigestion, but when they appear suddenly without a clear emotional or physical trigger, it's time to look deeper. Ask yourself, did I break into a sweat while doing nothing physical? Was the sweat cold or clammy rather than warm? Did it come with discomfort, tightness in the chest, or unease? Even if it passed quickly, these are not signs to ignore. You deserve peace of mind, and ignoring warning signs isn't strength, it's risk. So if this sounds familiar, don't hesitate. Talk to a doctor. Get checked. Have your nights changed? Is sleep harder to find or harder to stay in? Let's take a closer look. Silent symptom. Number 5. Disrupted sleep or trouble sleeping. A good night's sleep is one of life's essentials, especially after 60. But if you've been tossing and turning more than usual, or waking up gasping or uncomfortable, it could be more than just aging. Sleep disruptions may be an overlooked sign that your heart isn't resting while you are. This might sound surprising. After all, many seniors struggle with sleep for various reasons. But certain sleep issues can actually reflect changes in heart health. If your heart isn't pumping efficiently, it can cause fluid buildup in the lungs or increase pressure in your chest. That in turn makes breathing harder at night. You may not even notice the breathing difficulty while awake, but when you lie flat, it becomes more obvious. Some warning signs in sleep include waking up short of breath, needing multiple pillows to sleep comfortably, restlessness that feels physical, not just mental, feeling more exhausted after sleeping than before. In some cases, people even experience nighttime chest pressure, unexplained anxiety in the dark, or repeated awakenings with no clear cause. My advice here is deeply personal. If sleep has changed, don't brush it off. A tired heart can keep your body restless, even while you sleep, and your body knows something's wrong before your mind does. Sleep isn't just about rest. It's a vital time for your body to regulate blood pressure, repair tissues, and restore balance. If your heart is under strain, this process gets interrupted. And here's the key idea. If sleep disturbances are new, unusual, and not tied to emotional stress or external factors, they're worth investigating. Ask yourself, have I been sleeping worse lately without any change in my lifestyle? Am I waking up tired, even after what should have been a full night's rest? Do I feel tightness or unease when I lay flat in bed? These are not just sleep problems. Sometimes they're early signs of cardiovascular stress. And remember, you don't need to feel chest pain to have a heart problem. Now let me ask you this. Have you noticed any unusual aches in your arms, back, or jaw that just won't go away? If so, don't miss the next part. We'll talk about two more silent signals that many people ignore and the simple steps you can take to protect your heart starting today. Silent symptom number 6, pain in the jaw, neck, or back. When people think of heart attack symptoms, they usually picture chest pain, but the heart doesn't always follow the rules, especially after 60. Pain that spreads to the jaw, neck, or upper back can be a silent sign of a heart attack in older adults. Here's why this happens. Your body's nerve pathways are deeply connected. The nerves that serve your heart also communicate with areas like your jaw, neck, and upper back. When the heart is under stress or losing oxygen, your brain sometimes misinterprets the pain signals, sending them to unexpected places. This is called referred pain, and in seniors, it can be one of the only signs something's wrong. You might feel a dull ache behind your shoulder blades, a sudden tightness in your jaw, or a strange pulling sensation down the neck or along one side of the back. What makes this symptom so tricky is that it's easy to blame on arthritis, posture, or muscle strain. After all, many people over 60 deal with occasional aches and pains. But what separates this kind of pain is that it's sudden or unusual, doesn't go away with rest or stretching, and may come and go in waves. You might feel discomfort that doesn't make sense, especially if it arrives without any physical exertion. From my perspective as a physician, I always advise this. If you feel pain in your jaw, neck, or back that's new, persistent, or paired with fatigue, nausea, or cold sweats, don't ignore it. It may not be muscle pain at all. It may be your heart speaking through other parts of your body. Ask yourself, has this pain happened before? Did it start suddenly and without reason? Does it feel deep or different than typical stiffness? If you're unsure, don't wait. Get checked. You won't regret being cautious, but you may regret ignoring it. Silent symptom number 7, irregular heartbeat or fluttering sensation. The last silent symptom is one that many seniors notice and dismiss. A fluttering, racing, or irregular heartbeat can be your heart's way of waving a red flag. When the heart lacks oxygen or is under strain, it can beat out of rhythm. This is known as arrhythmia, and it may feel like a skipped beat, a pounding or flip-flop feeling in your chest, a racing heartbeat even while resting, or a strange thump or flutter lasting just a few seconds. Some seniors describe it as a bird fluttering in their chest. Others say it feels like their heart is tumbling or beating too hard. What's important is not the exact sensation, but the change. If your heartbeat feels different from usual, and especially if it happens more than once, it could be a sign that blood flow to the heart is being disrupted. And if it's paired with shortness of breath, dizziness, or fatigue, that increases concern. From my years of listening to patients, I've learned this. Your heart speaks in rhythms. When the rhythm changes unexpectedly, pay attention. Yes, occasional palpitations can happen with stress or caffeine, but if this feeling is new, more frequent, or happens while you're calm and resting, it deserves attention. Ask yourself, have I noticed fluttering or pounding in my chest that I can't explain? Is my heartbeat irregular, too fast, or skipping beats, even while I'm sitting down? Do I feel weak, dizzy, or tired when it happens? If the answer is yes, don't shrug it off. Your heartbeat is your body's internal drum. When it beats off rhythm, your body is trying to get your attention. My personal message to you: if you've made it this far in the video, I want to say this directly. You matter, your health matters, and it's never too late to listen to your body. These symptoms are called silent, not because they make no sound, but because they're easy to dismiss. Especially after 60, we tend to normalize discomfort, but that doesn't mean we should ignore it. You've learned the 7 silent symptoms: unexplained fatigue, shortness of breath, nausea or lightheadedness, cold sweats, disrupted sleep, pain in the jaw, neck or back, irregular heartbeat. Now let me ask, have you felt any of these in the past month? Have you brushed them off because it's probably nothing? Are you feeling a little more aware of your body right now? That awareness is power, and the next step is simple. Don't wait for pain. Don't wait for collapse. Don't wait at all. If you found this video helpful, hit the like button so more people over 60 can see this and protect themselves. If you've ever experienced one of these symptoms, leave a comment below. I'd love to hear your thoughts, and you might help someone else recognize a silent warning. And if you want more easy-to-understand, senior-friendly health tips, subscribe to the channel and turn on notifications. Your heart's still beating. Let's keep it strong, together.